Since the first major Ebola outbreak in 2014, Nebraska Medicine has been at the forefront of treating infectious diseases. Tonight's episode of SEAL Team will discuss the disease, but doctors here in Omaha want to put to bed any rumors about how the disease spreads. 3 News Now reporter Sydney Gray shows us how treatments have changed since 2014.
Ebola was really thought of as an almost universally fatal disease that you really couldn't do anything to mitigate the outcomes there.
Just 5 years ago, Ebola was a major cause for concern.
We've learned a tremendous amount about how to treat Ebola and similar diseases since the outbreak started in 2014.
Dr. James Lawler, who heads the biocontainment unit at Nebraska Medicine, says since then, a lot has changed.
We have new technologies that have come to light which should significantly help us manage disease. So for one, there is what appears to be an effective vaccine.
The hospital recently performed a drill involving a team treating a mock pregnant Ebola patient. Dr. Lawler says compared to 2014, they're ahead of the game.
We also have 2 new therapeutic products which have been used again in 2014 in the first ever real multi-arm clinical trial of therapies for Ebola. And these 2 products seem to provide benefit for patients who are infected.
Dr. Lawler says Ebola isn't contagious before people develop symptoms, so it's not airborne.
Ebola, for instance, is primarily a contact transmission disease, and so we focus specifically on precautions so that we don't come in contact with blood and body fluids.
Nebraska Med has seen just 1 Ebola patient since 2014. That patient was exposed about a year ago at a hospital in the Congo. And with the new national quarantine unit, Nebraska Med says they're ready for whatever comes next.
We really are at the forefront of how you do isolation care effectively, and we think that we have the best team and the best training, and we're always ready to manage these cases if they do present themselves in the U.S.
In Omaha, Sydney Gray, 3 News Now.
You can learn more about the Ebola virus on Nebraska Medicine's website.